Have you ever wondered whether your mental health or your mental well-being is actually linked in with the physical manifestation of how we actually feel? This was something that was massively disregarded by doctors and the medical profession for a really, really seriously long time. And what we've basically come to learn now is that it cannot be disregarded. So my name is Patrick Hogg and I'm speaking to you from Complete Health Eastbourne. I really just wanted to touch on the subject, especially now whilst everything is starting to return a little bit back to normal. Stress levels are going up, people's levels of confusion are very, very high. And I'm seeing a sudden spike or appearance in some of the complications that I'm seeing with some of my clients in the clinic. Now, mental well-being or mental health or stress levels have always been considered, but never really actually in the forefront of understanding whether someone's having a physical manifestation based on what they are feeling or the pain that they're having. Now, if we think about it, where do you actually feel pain? And when we ask that question, when we think about that question, obviously the tissues create a sensation, but the place that the pain is always received is in the brain. And if our brain is wired up by all these negative thoughts, all of these emotion patterns, and all these negative changes, what it seems to do is hardwire the brain and the neuroreceptors and the hormones in our brain to feel in a slightly different way. And pretty much every single thought, every emotion, every process or action that our body has to go through, a neuroreceptive pathway has to be stimulated. And what we know about pathways that are used the most, they become the strongest. So if someone is consistently using the pain pathway, or consistently using the stress pathway, or consistently using a certain muscle pathway, those pathways become stronger. So if that thought is consistently going through your head over and over and over and over and over again, guess what? It becomes more and more and more easily triggered. Now, one of my favorite people to listen to is Dr. Joe Dispenza. I've listened to hours and hours of his content. And actually, you can create a change in your physiology. And this has been measured. This has been measured on countless occasions. And you can read this in his books, Becoming the Supernatural. You can also read this in his book, You Are the Placebo. And it will show you exactly the changes in your brain chemistry, your brain physiology, and your neurology, and the activation of certain components of your brain based on the thoughts and the emotions that we're having. Now, my experience, I am yet to have a patient come through the clinic who has had fibromyalgia, who has not yet had a physical or mental abusive background. This is my experience. It's not to say that there aren't people out there that haven't had these kinds of things. However, almost always, whenever I've had a patient that's had fibromyalgia, that I have almost always seen that there has been some level of abuse in the background. And as a result, what we know about that abuse, that pathway, that constant trigger, essentially their brain is then wound up to feel or perceive those emotions or feelings because they're so easily triggered. So as a result, what starts to happen is those pathways in the brain, in the nerve system that were wired to feel brain when you were being abused, now only need a very small stimulation in order to produce the same result. And our job as chiropractors is really to teach your brain and your nerve system to actually down-regulate that, take it down. And there are ways that we can do this. What we know about things like fibromyalgia is not necessarily a treatable disorder. However, we can certainly manage what's going on and a lot of people with fibromyalgia or pain syndromes will know that if they do a combination of different therapies, such as exercise, meditation, CBT, and diet control, they can start to see changes in the way that they think, they move, and they feel. And what we know is by changing those things, what we can actually start to do is down-regulate those pain receptors and really, really engage the brain to feel a lot less than what they were before. We can also bring the inflammation down in the tissues, so the tissues are not stimulating the brain quite so easily, and as a result, we start to inhibit those pathways so people are not constantly feeling pain. However, it's like training. You have to untrain the brain to feel the emotions or the triggers that you were feeling before. If you want to learn a little bit more about this, guys, we are called Complete Health for a reason. We're called Complete Health for a reason. The reason being is that not only do we offer chiropractic services, not only do we offer massage, not only do we offer physio, we also have other people in the building, including podiatrists, psychotherapists, and counselors as well. Because what we know about people's health is the complete package that's really, really, really going to actually serve those patients to be the best version of themselves. That's all from me today, guys. Enjoy this sun. Have a glorious day. We've got a super busy day here again at Complete Health. And so we're going to be really helping as many people as we possibly can. Keep your eyes peeled, because actually I've spoken to some of the other local businesses, and some of the local other businesses here in Eastbourne are going to be wanting to help us to help you guys actually enjoy coming out of this lockdown period by offering some of our clients some exclusive offers in their cafes, in their shops, and some other areas and services that we've got around the area as well. So keep your eyes peeled. We're also going to be doing some fun competitions in the clinic over the next couple of weeks. So just keep your eyes peeled when you're coming in, and we will keep you updated. Speak to you soon.